Good morning. I am Bob Ravenscroft, the Vice President for Advancement. Here with me today is John Woodrich. Before we get going, a couple of big things going on this weekend. First, Juneteenth celebration. Bryan has had a long-standing relationship with the Malone Center in Juneteenth. Unfortunately, this year because of COVID, it's not as robust as it's been in the past with health fairs and some of the activities. I know they were encouraging people to celebrate at home, but our hearts and minds are with you over at the Malone Center and the entire African-American community as we celebrate Juneteenth, and it's an opportunity for all of us to listen, learn, and celebrate along with them. Another big one coming up this weekend is Father's Day. So for those celebrating Father's Day and Juneteenth, just please, practice hand hygiene, mask yourself, keep your families as distant and as close at the same time for these wonderful gatherings as possible, but be cautious and be safe out there. Quickly before we get to the stats and I turn it over to John, again, we're in the maintenance phase of our crisis communication response to the pandemic, and what we're going to do next week is we are going to back down these briefings to Tuesday and Thursday. Every Monday, Wednesday, and Friday, you will get the press release. We feel it's important to continue to provide the media with numbers of what's going on here at Bryan so they can reconcile it with all of the various sources they're doing to track this and communicate to the community. Even though we're doing this, we are in this for the long haul, as we've said many times, until contact tracing, testing, and ultimately vaccines in place. It's going to be something we're dealing with. So our advocacy for hand washing, social distancing, and wearing masks is not diminishing at all. What this will also mean is members of the media, we will resume one-on-one media requests with you. With our visitor restrictions in place, it might not be possible to always bring you on site. But as we're just addressing the media, twice a week through this medium, we know you might have questions. So in a way, it's a phase back to normalcy in our interaction with the media. Clearly, some of the questions that might be asked could be addressed in this setting. But otherwise, we will try to get you connected with the people at Bryan for you to follow your stories one-on-one in the best way possible. So again, press releases on Monday, Wednesday, Friday. We'll do things to keep our public and the Facebook Live crew updated as well. And then we will appear on Tuesdays and Thursdays for robust tests or questioning from the media and answering anything you want, and have them continue to be COVID-19 specific on Tuesdays and Thursdays. Let's get to the stats. Our midnight census was 492. We have now administered 11,879 COVID-19 tests at Bryan locations. The positives have grown to 1,542, and right now we have 358 tests pending. With that, John's going to share a little bit about what's going on here in the medical center, and then we'll answer any questions you might have.
Thanks, Bob. It's been a while since we shared with you our percent positive. So of all the testing that we've done, with the exception of our mobile unit, we're at about 12.4%. Seems pretty steady over the time period of the last several weeks. We still do have 11 positive COVID patients in-house, 9 of those from Lancaster County and 2 from outside of the county. 5 of those individuals are on ventilators, 6 inside of our intensive care unit, 3 in our progressive care unit, and 2 in our general care unit. We haven't shared with you recently about our mobile unit. It appears that we're starting to wind that down a little bit. And we will still have the capabilities later on should we need to go to a specific location. But we're probably winding down to the point that we'll turn back in the RV that we have been utilizing, but we have the capabilities of putting all the equipment in another vehicle and responding should that need arise if we have another surge.